So good morning and welcome to Motivation Monday. Hopefully we can pass on some little tidbit of information that helps you in your business. Let's see, we'll be looking at, stats from last week and let's just get rolling here. Of course, my little changer doesn't want to work. So let's see, there we go. Okay, our quote for the day: if the plan doesn't work, change the plan, but never change the goal. From Anonymous, one of my favorites. See, we get a lot of those from him or her. So let's see here. What do we got to get things going with here? See, usually it's our tip of the week, then some sales shout outs. And today's little mini topic will be Medicare compliance for those who sell Medicare. So for our tip, went and watched the Netgen Senior Supplement Symposium this last week. And while they talked about all the products that are out there right now, I thought I'd kind of center in on what's coming up here in the next year. I mean, for this quarter of this year, Netgen launched their senior dental plan. It's only in about 8 or 9 states right now, but it looks like it's going to turn out to be a pretty popular product. A lot of good stuff in there, if you can see that online. But these are the new products that are slated to come out here in 2021. In the first quarter, they're looking at launching the senior indemnity plan. This is really set around those people who aren't in Medicare, but they're seniors. They've come to the country. Maybe they're visiting. Maybe they're just didn't work enough to qualify for Medicare or whatever. Trying to give them some sort of a plan that would be available to them. And then in the second quarter, they'll come out with a senior hospital indemnity plan. This is one that I've been really looking forward to. Works great with the Med Advantage plans. They got all those zero-cost plans out there for Medicare Advantage, but they're full of liability. Like $450 a day if you're hospitalized. Anyway, the senior indemnity plan should come in and fill those gaps. Should be a great product for that. And then in the third quarter, they're actually looking at launching some sort of a short-term plan. And I think the idea behind the short-term will be the way it was described is something that would go with the plan that you already have, but kind of fill in that area that was typically covered with a long-term care plan. So it's just, but it's more of a short-term, just like you have in for your work, you have a long-term liability and a short-term liability. This would be that short-term plan that would fit in there. So anyway, those are some new products to look forward to in the new year. So we'll keep our eyes out for that. Some sales shout outs. Okay, so it looks like the big seller for short-term was the Netgen plan. Right immediately, I didn't note it on there, but it was followed up by the golden rule. Okay, in fact, when we look in the lower section, Max Weinstein, who was one of the top, all of his were golden rule, but still it was the Netgen that kind of carried the day in there. Whereas with limited medical, golden rule, I mean, there was some Netgen being sold, but it was really a golden rule that was the popular limited med plan. For accident, again, Netgen. I think it's because when you do those short-term plans, you just automatically pair them up. So obviously, if the big leading seller in short-term was going to be the Netgen product, I would expect the accident to go with it. However, I would have also thought the critical illness would have gone with it, but it looks like critical illness went with golden rule, as did dental. Are big sellers, and it kind of just goes with that upper section. The was Max and Sean. I think Sean was doing mostly the Netgen, but Max was doing the golden rule. In limited medical, we had Timothy and Arthur doing limited med. Again, accident, Max and Timothy. I mean, kind of strange how it seems to be these ones in there. And then in our Medicare sales, it was Donna and April. And I believe Donna was doing the Medicare supplements, and April was doing, was our leader there in Medicare Advantage plans. Well done to all those, all doing a really bang up job there. Really like that. Okay, so now what we're going to take a quick look at is a Medicare compliance. Okay, trying to keep everybody on the straight and narrow. Medicare has got more rules than you can shake a stick at when it comes to selling it. Lots of do's and don'ts. Okay, so what we're really going to look at is what's called the Secret Shop program. I always found it kind of, you know, I was shocked when I first heard about it. But anyway, as it turns out that not only CMS and, you know, which is the Center for Medicare and Medicaid Services, that's really the government, okay? But also the carriers. They literally do these secret shops, and they're out there, they're calling up agents, they're attending, if you put on a seminar, they'll come and be a member there, and they're all just looking, and they'll be asking questions just to see if you're following all the rules. You call it a, you know, like an educational seminar, they'll be the one asking about a specific carrier, looking for you to say, I cannot answer questions about specific carriers, or you're going to have to see me later for something like that. In other words, they're just, you know, out there, I wouldn't say trying to throw you a curveball, but really just trying to make sure that you're out there following the rules. So there's some secrets to passing these things. And I just start off with just leveraging your professional integrity and ethics. Everybody here is a professional. So just keep that in mind, and that this is all relationship selling anyway. So just follow all the rules and do it, you know, with integrity and using ethics, and that'll be your secret there. So one of the things, though, is you should know what are the actions and inactions that can contribute to passing or failing a secret shop. We'll highlight some of that here this morning. And like I said, you know, basically recognizing some of the do's and don'ts of selling Medicare products. What we're really, this is our goal, right? We don't want infractions, allegations, sales training incidents. When it comes to allegations, if you don't have any allegations, you really just haven't been selling Medicare long enough, because they are going to happen. So if I were to ask you what you could do to improve the chances of passing a secret shop, kind of a rhetorical question, because most of us would all jump on staying compliant. And if you said that, or you thought that, you're absolutely correct. I mean, that's what you have to do. And that just means, you know, doing everything, doing, you know, saying all the words, reading all the script, not skipping slides, you know, just going through the whole sales process. And when you do all that and you focus on the right thing for your customer, you'll be compliant, you'll pass the secret shop. And I would like to say you wouldn't get any allegations, but I can tell you, you still will, because I don't know if on this one I've got some to show you some of the allegations. I usually like to use ones that I got and then how I avoided them and how I stayed clean with them. So I always figure the more you're aware of you know, what they're looking for, the better off you'll be. So basically, these are kind of the do's. If you're making a marketing appointment or you're setting up a seminar, you got to show up on time. You know, just do what you said you were going to do. Now, explaining that the customer must continue to pay their Medicare Part B premium, unless, of course, it's paid by a third party. But That's one of the areas of the biggest complaints. I didn't think I had to pay the Part D. Okay. Scope of appointment. Medicare requires that you review before the presentation and discussion with the customer that you have this document signed. And what that does is it says what you're going to discuss. In fact, if somebody brings up something that is not on the scope, you literally are required by the law to stop, redo the scope of appointment, and then continue on. And so the other one that kind of goes with it, remember I was saying that you just want to be all inclusive there, is that when you do a sales presentation, you can be using a PowerPoint, or they've got little flip books that the carrier will give you. You can't skip anything. You literally have to cover every page and every slide. Now, my recommendation to really stay out of trouble is to get some kind of recording device for your phone. It is so much easier to respond to either the carrier or CMS when you can just simply provide the recording, and it's something like, at time 12, I told her that Dr. Smith was not in the network and she agreed to change doctors. Okay, so I mean, that would be the classic, he told me my doctor was in the network and he isn't. Well, it's nice to have the recording of the discussion that the doctor was not in the network. So I would, get some kind of a recording. I use Android. If you go on to the, Google, and you can find, in the Play Store, there are just all kinds of recorders for Android. I don't use Apple, but I did Google, what was out there for Apple, and I didn't see anything. So that's why I said good luck. I mean, you may have to get some kind of actual mechanical recorder or something like that. But when you're working, with a customer, I'd always literally talk to the recording. I would do all the same things, say all the statements, and just record all that. This way, when you do get an allegation, you're covered. You've covered everything that you're supposed to. You do all the things, you look up all the medications, you look up all the doctors, you tell them in network, not in the network, in the formulary, not in the formulary, and just kind of take it from there. And it's really great just to be able to go back and say, yeah, here's my recording of the sale, go to time 12. So follow these, the sales procedures and compliances at all time. The most valuable tool that you have is just your integrity and desire to do the right thing. I want you to stay on that. Understand why the rules are there and use them to your advantage. The scope of appointment, it's a requirement. Now, they did soften some things up during here with COVID-19 when most of the meetings are not face-to-face, but I'd stay on top of that. I know that Anthem would allow you to verbally give them the scope of appointment, and then on the paper form, after you got their consent, you wrote verbal consent on where their signature went. I just kind of really watch it because each of the carriers will have their own particular rules. But one of the things I do like to point out that when it comes to that scope of appointment, you can use anybody's. It doesn't, you could be selling Aetna and using United's scope of appointment. The only requirement is that the scope of appointment must be CMS approved. So as long as you have a CMS approved scope of appointment, it doesn't matter with any of the carriers which one that you actually use. Most of them make them very simple in their own enrollment websites. That the tool is there. If you fill out the scope of appointment, typically on the website, and it's all done electronically, when you go to the application, all those things will be pre-filled on there: name, address, birth date, that kind of stuff that winds up in a lot of scopes. So some other things. and this is where you can get yourself in trouble, is that you need to fully give somebody the presentation. I mean, they've told you up front, I'm shopping for my mother, and I'm interested in this plan. Or, you literally have to give them the full presentation. Okay? Even if you knew up front that it was not going to result in a sale, that doesn't relieve you of your obligation to give the full appointment. And again, you know that they're going to be looking for that. And every presentation must be conducted in full. So, I mean, it can be very tempting to, shorten it up, be abridged, partial, skip over something because it doesn't apply, those kind of things. That will not be a compliant presentation. Now, the carrier will give you either in the form of a flip book, right, where you can sit down in front of somebody and flip through the page, typically something on one side for the customer, and then while you're sitting, on the back side of the flip book, it's got, words for you to read, okay? And then, or it can be in the form of a PowerPoint, where you're showing the PowerPoint, but you're reading a script that gives all the words in there. Okay, so I always like to give you an example, and this is a personal example of an allegation. And the particular one I had was the customer specifically asked for looking for a plan with transportation. Okay, was shopping for a Medicare Advantage plan and needed one with transportation. That was kind of the way the whole conversation started. So we go through all this stuff and we're down to, okay, here's a plan that has, the transportation in it. It gives you so many trips to the doctor or the pharmacy, to the hospital, whatever you need. And so that was pretty agreeable. But when we went to look up the guy's doctor, it did not have that doctor in network. So his doctor was not in the network. So at that time I said, well, let's see what plans have your doctor in network. So it turns out he was one of those doctors that was, I could only find him in one plan, but that plan did not have transportation. So we had a big lengthy discussion about what's more important, transportation or doctor in network. He says doctor in network is the most important thing to him, and that even though he wanted the transportation, he needed to have his doctor in network. So he buys the plan with the doctor in the network. Lo and behold, about a month later, I get the allegation. He told me this plan had transportation. Well, like I said, record all those conversations. When it came back and I played the conversation, or actually I don't play it for them. I listen to it and then provide them with what minute into the conversation is most pertinent. And there's this whole discussion of, what's more important, doctor, transportation, doctor, etc. And so it comes back as an unfounded allegation. Another one that I got is that the customer said that I sold them a plan that didn't have prescription coverage and told them that it did. Okay, well, again, everything was recorded. In this particular case, it was an individual that lived off in the sticks somewhere, and there were 2 plans available in that zip code, just 2. One was an MA plan that did not have any prescription coverage, but the cost was 0. The other, from the same company, did have prescription coverage, but was $75 a month. Well, the customer said, I can't afford $75 a month. I'd like to have the 0 cost one. So again, on the recording is a full discussion of not only that doesn't cover prescriptions, you could be subject to a penalty later on for not getting a plan with a prescription, with prescription coverage, for not having that. And but they insisted that I told them it had prescription coverage. Well, as it turned out, it was Humana. Humana has a voice signature on their application where you turn them over to a recording. You know, you call in with the customer, you put them into a recording, and the recording gives them all the mandatory information. So that was Humana's way of making sure that all the disclaimers were read to them. But they give the customer an option to break out and ask a question. Okay, well, as it turned out, and you can see that if you know how to read the account, you know, where it shows, what time they went in and what happened, and then when it was finally approved, which is all documented. But you could see that they left the recording and went into a discussion with somebody in customer service. Well, it turns out that's who told them that it had prescription coverage. It wasn't myself, but me having the recording is what saved my butt. So I always really push that on anytime I talk to people. And if you want the full description of everything that goes on and all the tips and all the points to look out for, Thursday at 10:30 is going to be the full webinar on compliance and secret shop. Today was just a little tidbit to kind of point out a few things and make some recommendations for you. But if you want the full talk, tune in on Thursday, and we'll have about an hour or so of compliance do's and don'ts. So that's what I have here for today. If anybody does have any questions and would like to discuss it further or whatever, just send me an email at training@ahpsales.com, and I would be glad to to really go in depth over any of the topics in Medicare or Medicare compliance in particular today. So with that, I hope you all have a good week. So have a great day.